Hello, my name is Jessica. I'm a fourth year, for those that do not know, fourth year medical student, and today I'm making a video for all those who are about to start third year. So in today's video, what I'm going to try to do is answer all the questions that people have been asking me about starting clinical years and talk about some tips for being in hospital and work-life balance and some negatives of the year as well, and what you can do to make the most out of this clinical year. So there's so much to talk about, so I'm gonna have to try and just be as quick as possible. So I'll get started right now, and if there's anything that you feel I don't go into enough detail about, then just comment below and I can maybe make another video, because I just don't want this video to be too long. Okay, so I'll get started. So third year is very different to first and second year because it's a lot more clinical. Half of your time you're going to be spending in uni and the other half you're going to be spending in hospital. So firstly, I'd say that third year is again a step up in terms of workload, and it's very different, as I already said. So right now it's going to be much more clinical. It's going to be more patient focused rather than, you know, the pathophysiology, the pharmacology. Like, you have to think about it all at the same time and how that actually affects the patient. The timetable, so with my uni at least 6 weeks on placement, 6 weeks on uni, and you keep on alternating like that. Your placements are going to be GP, surgery and medicine. My one last year was medicine respiratory, my surgery was urology, and my GP was GP. So in terms of the learning objectives, they kind of just give you a whole list called a clinical priority list with like about, I don't know, it's like pages of diseases, and they're just like, here, there you go, learn them. You're kind of just left out into the wild by yourself. So if it's the beginning of the year and you're feeling lost, confused, betrayed, don't worry, everybody feels the same way, and just trust me, by the end of the year you know what you're supposed to do. There's loads of textbooks that I would recommend. The main ones that I used were Kumar and Clark's Clinical Medicine, Oxford Handbook of Clinical Medicine, aka Cheese and Onion, and then I used a question book as well, but that's more nearer exam time, and nearer exam time I can make a video about how to revise for third year exams and OSCE if that's what you'd want as well. I'm trying to think of the book now, it's escaped my memory, the questions book, but never mind. Okay. So lectures in the 6 weeks of uni, I would say to attend them, because again, you're just left out in the wild in like third year. So I would say to attend the lectures so that you can have a little bit of an anchor of like, okay, are you going down the right road, or are you just barking up the wrong tree kind of thing. And then I'd recommend the grey book, which is like the standard guidelines for all like emergency and major diseases. So for placement, what you'll need is a stethoscope, a good stethoscope. The first stethoscope that I bought was like a £5 one off eBay. So don't do that. Don't get a cheap one. Like, if anything, ask for one for Christmas time or something like that, because it does make a difference. And you need to start getting comfortable listening to the heart and the chest and everything like that. So a good stethoscope, a notebook and a pen. So a little like A5, I think it is, yeah, A5 notebook and a pen, and like a side bag that you can wear when you're going around the ward. So you're allowed to wear a side bag. I don't know if guys wear it. Do guys wear it? I don't know. If you want to, you can. And yeah, where you can put your stethoscope, your notebook and pen in there, and your phone in there as well, because there's loads of apps that you can download. You can download the BNF on your phone, so you can easily just quickly access drugs if somebody asks you what the dosage is of something is. Okay, and you're gonna need comfortable, smart shoes. I repeat, comfortable, smart shoes. So in the mornings, you're gonna be going on ward rounds. You're gonna be on your feet for like 4 hours plus, and you need to be comfortable. Otherwise, those ward rounds turn into, yeah, just make sure you're comfortable, and wear smart clothes as well. Smart clothes as well, because first impressions count. Before you go onto the wards, make sure you read up. So for example, as I said, I was on respiratory, so I made sure I looked at my respiratory lobs, and I did like a quick overview of that. You can't learn everything in detail, but at least know what's going on, so that when you're on the wards, you're going to learn and absorb a lot more if you have a little bit of an idea of what's going on. If you go in there blind, firstly, it's rude to the consultant whose wing you're under, and secondly, you're not going to learn as much. And if they ask you any questions, they're not expecting you to know everything. Some consultants are nice about it. Some consultants are savage about it, and that's just the way it is. Make sure you have a thick skin, because some consultants really don't mince their words, and if you don't know something, they're just like, go read up on it, and you're like, okay. So what's expected of you on the wards? What's expected of you? So it's only your first year of clinicals, and make sure you tell the doctors that, so that they know. So what's expected of you is to clerk patients, and by clerking I mean taking a relevant history, and examination. So if this is a mistake that I made, and what I wish I knew when I was going in. So clerking means history and examination. The worst thing you want to happen is like for a doctor to go say, okay, go clerk that patient and come present them to me, and then you go clerk them, you ask them a full history, everything like that, systems review, and then you come back and you forgot to examine them. And examining doesn't just mean listening to their chest, it means doing a whole respiratory exam, or whatever systems you need to, whatever exam you're doing, cardiovascular, neuro, etc., etc. Okay. And you're gonna have a list of DOPs. At my uni, you have a list of DOPs that you need to complete. So that's different tasks such as blood cultures, bloods, ECG, oxygen, different things that you need to complete whilst you're on the wards. So the easiest place to do most of those DOPs are on your medicine placement, and try to get as many done in third year as possible, because in fourth year you're gonna have more things to worry about. So at least in third year, just try and do that. You're gonna be expected to learn on the job. So as I said, it's no more about like pathophys and pharm and thinking of those separately. No, you need to put it together. It's like the real world now. So you'll be seeing the diseases in action, and that, like, even though the clinical priority list might seem a bit overwhelming at the moment, and going on the wards might seem overwhelming, but it's like the best way to learn, and you learn so much more just by being present, by learning, by doing. And then when you see, so say for example you go on a ward round, which is when you and a consultant and the other doctors go around in the morning to look at all the patients. If they say something, if there's a drug there, or when you're taking a history from someone and there's a list of drugs, any drugs you don't know, go home, make a flashcard about it. Any diseases that they mention or something that they don't mention, go home that day and look it up, okay? Because it's going to be fresh in your mind, and I'll talk a little bit more about that later on, about what I do. I was also asked, how do you build a good rapport with the wards? So this is a good one, because as a doctor you're going to be part of a team, so being naturally like a team player is obviously very important. So as I said, read up on the stuff beforehand. That's going to show that you're passionate, and the doctor is going to be more likely to teach you a bit more if it seems that like you're interested. Help nurses with their jobs, the ones that you can, so like maybe taking bloods. What else was I comfortable doing in third year? I can't remember, but whatever you're comfortable doing, then try and do that. Oh, taking mockers, which, look it up if you don't know, MOCA and MMSEs, you can do those. So sorry, I'm looking over there because that's where my laptop is. I've written notes down for you guys. And also, like, so for example, if now the consultant is doing the doctor is doing the ward round, and on examination they say dry oral mucosa, then when you're leaving the cubicle, then just make sure you fill up the patient's water and give them something to drink, and make sure that the cup is in reach of them. You know, genuinely caring for the patient. Those type of things are going to be great. Okay, and as I said, so when you see a pathology from clerking a patient on that same day, go home and read about it. So I'll let you guys know like a secret or a tip that I've been recently doing is like, if I see a patient on that day with like a unique pathology or a disease that has like that, and they perfectly fit like the epidemiology of that disease, next to it, so if it's like heart failure, then next to it I'll put what the patient looked like. So if they have something memorable like a brown bob, or then the other day somebody had like really like gothic tattoos, and I put that next to the disease, next to that the disease title. I don't know if I'm making sense, because I'm trying to say what I do without revealing patient information. But like, okay, let's say there's heart failure, and then you saw me with heart failure, God forbid, but that's the patient there, then you'd be like, girl in tracksuit with high bun. So you put heart failure, then in brackets, girl in tracksuit with high bun, and then whenever you think of heart failure, just think of that girl, and then you'll like remember everything about heart failure. So that's for if you have a pictorial memory. So pin diseases onto patients you've seen. Okay, and I would say when revising, start with questions early on to consolidate your studying. So because it's very different from first and second year, you can't just recite facts. You have to practice working out problems. So it's like any puzzle. It's like, think of it more as like, it's like any puzzle. Practicing how to solve puzzles will make you better at like the harder and harder ones. And most questions have patterns. Like once you've answered like 100 questions, you kind of know what the next 100 are going to be like. So I would really also recommend PassMed. Make an account with them, buy it. It's like £25 for the year, which is definitely worth it. And start questions early on. Don't just start questions when you feel like you're going to get them right. Getting questions wrong and learning from them is more valuable than getting a question right, I think. But as I said, I'll talk more about revision in another video. Okay, now I'm going to talk about the negatives of third year, because this is what people were asking me about. A lot of people asked about feeling in the way or feeling like a third wheel on the wards. So yeah, definitely you can feel in the way. It's annoying, you have to keep asking like staff to sign you off things, or if you can join in on things and stuff like that. But just make sure that you're confident. You deserve to be there. It's your responsibility to be there, and it's how you learn. So always put your learning as like in the forefront of your mind, kind of thing. Like, don't feel bad. You're not bothering people, because it's all for your own benefit, so you can be the best doctor when you graduate. And yeah, so what I'd say is just be confident. If you're on the wards and you feel like you've got nothing to do, then go and clerk someone in your own spare time. If you have like, because normally you go on the wards in twos, so you and your partner, you can go and clerk someone. One of you can watch whilst the other one is with like a mark scheme on your thing. You can do a little bit of a OSCE with your partner, like in between times where you're just like waiting around or there's nothing to do. And if you feel like you've done lots on the wards, then you don't need to stay around on the wards too long, because of course you need to go home and study. So I'm not saying skip ward time. If you're supposed to be on the wards, fine, but I'm saying be responsible for your own time. If you feel like you're not learning, or you feel like you're not wanted, then if that means taking an hour out to go revise and then coming back to see if there are any jobs, then I don't see what's wrong with that. But make sure you are where you are supposed to be when your timetable says that you are supposed to be there. Again, increased workload. It's another step up from second year, unfortunately. But as I said, because it's completely different to second year, so it's a step up, and then it's also like a different ball game. So you can feel lost at first, but just don't worry. Everybody feels like that, and you'll soon get into the knack of things. And the more you put in and try, the more you'll get out of it. So just don't worry. And somebody said, how do you manage work-life balance? I talked a little bit more about that in my first video. So maybe just check that out. Another negative, or it can maybe not be negative, is that you have much more independence. So as I said at the beginning, they kind of just give you a list of things and they're like, yep, there you go. You know, what's the problem? Do it. So that's why nearer to the time of exams and stuff, make sure that you are group studying so that you know that you're not barking up the wrong tree, and you're doing those practice questions. And also another negative is when some clinicians you come across are going to be so eager to teach, they're going to be so nice to you and accommodating, and then you get the other side as well where they're going to be so busy, they're not going to really care that you're on the wards, and you're going to feel more of a nuisance around them. So I would say, you know, again, don't take it personally. And what I would do if that's the case is I would go to the neighbouring ward, the GI ward, and see what's going on there. Like, why not? As long as you're doing what you need to do, and see if there's any people that are friendly there. But if you have to be with a certain consultant or doctor and you think that their level of nonchalance and their level of not teaching you is inappropriate, then do talk to your clinical teaching fellow or coordinator. So in every placement that you have for for medicine and surgery, you're going to have a clinical teaching fellow, and that's a person on your placement that their only job, they're a doctor, but for that year they're taking the year out just to teach you. So 24/7 they're there to teach you. And there's also a coordinator of your placement that 24/7 they're paid to make sure that your placement is going smoothly. So yeah, that is my video on clinical years. So that was more based to people just starting their first year of clinicals, but you can take some of the tips for any years. I hope that was helpful. I hope that you feel a bit less lost now. And if you have any questions, then feel free to comment down below or DM me. Yeah, and enjoy your third year because it's so much harder, but it's so much better, and you feel like a proper doctor and you start doing more. And just the main thing that I would say is the more confident you are and the more willing to get stuck in you are, then the more you'll gain, okay? So just know that you deserve to be there. It's your right to learn whilst you're on the wards and when you're in uni, and you'll be fine, okay? So thank you for watching the video and good luck.